My name is Roger Spencer. I am an MD, and I'm a staff physician with Central Florida Pain Management. We had a patient, young lady with central-based pain, secondary to a brain injury after a surgery. And she had terrific headaches and some generalized body pain. The treatment plan had been through what I would consider to be pretty much the basic nuts and bolts stuff. Most of the things that you would try to treat headaches and generalized body pains or centrally mediated pains with. Everything that we were trying was pretty much coming up to naught. I came in one morning and they said there's a report here from Best Doctors. I didn't really know what Best Doctors was at that point. I'd never even heard of it. But as I started reading through the report, I was very impressed with its thoroughness and the amount of research and work that had gone into it. I think it provided more than a few things that we hadn't thought of as far as taking care of this patient. We've instituted most of the things that this report did suggest for us and for her. What impressed me the most about it was it read like a paper that was being produced for publication. The thoroughness of it, the professional citations, the references that it included, the conclusions that were drawn, it was very reminiscent of a lot of professional literature. The expert was very well qualified. If I were to synthesize and start over again without this report in hand, undoubtedly it would have been tens of hours of literature search and research and discussion with other pain professionals to synthesize the information that I got in the report in 15 minutes. So it was a tremendous time saver for me. Certainly having this service is advantageous to the practice, because if I send that patient to a second physician as a backup consultation review, that patient may not come back to me. Where if I can get a Best Doctor's report back and the patient gets benefit without me having to send the patient out of house, that enhances not only the patient's benefit, but also the reputation of the practice. And certainly, medicine grows by spreading the information. Nobody benefits when the knowledge isn't really well understood or well distributed. But the fact of the matter is, in my opinion, there is no room for ego in medicine. You do the best by you can and by the patient. I was overall impressed with the Best Doctor's report. From my initial presentation, as I read through it, it seemed to introduce the patient in a very professional way, went through the literature citations, drew a conclusion, a diagnostic conclusion, and formulated a treatment plan in a very concise and very professional way. If it's something that a patient does have as part of their insurance, I absolutely will use it in the future.